Started off this time, Mitchell.
Hey everybody, I am Mitchell. I am a recovering addict. I just celebrated a year clean and sober, just on the 5th.
And I am Anna. This is my husband. I am a wife of an addict in recovery and trying to recover from enabling codependency and setting up those beautiful boundaries. And then right here, we have our lovely Laura Boberg. She's the one that, truthfully, guys, every single time you hear Mitchell and I say Laura, this is the Laura that we are talking about. So we definitely, being up here in Utah, we wanted to take the chance to basically have her talk to you about what goes on in the brain and then tell us a little bit about Laura. So take it off, Laura.
So should I start? Let me just get the stuff with me over with.
Yeah.
I'd rather talk about the brain stuff anyway.
Okay.
I am a substance use disorder counselor, and I've been in the field of addiction treatment for adults, probably 14 years now. And I like to say when I first got into it, it was by accident. I came and helped out when they were short-staffed at a facility, and I like to say I got addicted to addicts in recovery right away because I never left after that. So I'm also the adult child of alcoholic addict parents in recovery, and so lived a little bit of that stuff from the family dynamics as well. So I'm no stranger to it personally or professionally. Mm-hmm. So.
Thank you. Mm-hmm. And so, Laura, one of the big things that we do ask the questions and what really helped me in my recovery is when you taught us really what happens to the brain when addiction takes place. So I thought that would be something that's very beneficial to people out there struggling and for the friends and family to have a little bit more understanding that will help them as well.
Well, I think there are so many people that still there's such a negative stigma against people who are addicts because they're criminals and, not nice people and things like that. But I think that recognizing that addiction actually is a disease of the brain is vital to being able to help people. Because if we're just looking at them and judging them with negative opinions instead of looking at the problem that's actually occurring in their brain and the changes there and the way they operate and think and make choices, it's definitely the brain is an organ just like other organs in your body or other components in your body, and it is susceptible to change and injury just like anything else would be, in sickness. And so I've heard the disease of addiction being referred to as it has to deal with the choice-making part of your brain that's sick. And so we wonder why people don't make good choices. Well, because their choice-making part of their brain isn't working correctly. So so there are some actual physiological components to the disease of addiction and what occurs. Initially, when somebody uses addictive substances, that part of their brain may not be as dysfunctional as it does become over time as they continue to use, because our brain is a marvelous thing, and it continues to adapt and evolve as we go. And so the more things that we put towards it, the more it grows and develops. Just like if we were to give fertilizer to a plant, that plant is going to grow larger than it would have without it. Mm-hmm. So there are components that when we utilize parts of our brain more or less, they're going to adjust. I mean, when we go to the gym and work out, our muscles get bigger and stronger and more flexible. When we don't go, the muscles tend to atrophy and start to disintegrate or even shrink in their functioning abilities and become weak and flabby and things like that. And so our brain is an organism within us that is also adaptable, just like other parts of our body, and it can get sick and it can get injured, and sometimes it's already challenged from maybe malformation or alter brain defect of chemistry in the brain and so on. And so all of those things play a role in whether someone is what we call predisposed. That means that they're more likely to become an addict. So for example, me as an adult child of alcoholic addict parents, I have generations of family that have addiction in their lives, and so I am going to be much higher risk to develop the disease of addiction than someone would be that doesn't have that. And so it's definitely one of the questions that we ask when a patient comes in is, do you have this in your family and in your family history? Because different cultures even will have higher susceptibility or lower susceptibility. And so the genetics do play a significant role as well as the actual structure of the brain. If somebody's had traumatic brain injury or they have mental illness, they're going to be more susceptible than those that don't. So those kind of things. So where do you want me to go next?
Well, I know one question that does always keep going up and asking is why, when they're in addiction, why is there lying? Why is the lying? Do they know that they're really hurting us? So those are the main ones that we definitely get asked a lot. So really, I guess, why do they always fight when we do that?
Okay, so let me start with a little bit of an educational instruction first, and then answer that question, because I think it will be a lot easier. So I talked earlier about going to the gym and working out. Well, you don't go once and all of a sudden you come out there looking like Arnold Schwarzenegger, all buff and healthy and everything. It takes practice, and you have to do things repeatedly over and over and over again in order for your body to really grasp on to that and adapt to the changes. So what occurs in the brain of a human being, and let's say we start out with a normal functioning brain, and we introduce an addictive chemical, what happens is in the basic structure of the brain, there are different components that are responsible for different jobs. So like if you've ever had a new pair of glasses, you might get that headache that goes right back into the back of your head, which is where your occipital lobe is. The occipital lobe is primarily responsible for vision and so on. So depending on the area of the brain, so we're going to be talking primarily about two specific segments of the brain, which comprise of different components. But if you think about like the workings of a car, the brake system helps the car stop, and the electrical system keeps the car's motor running, and so on. And you can't run it without gas, and so on. You have different parts of your brain that are responsible for different jobs, and as you're looking at the different parts of the brain that are specifically associated with addiction, we're talking about the midbrain, which if I were to use my fist as the brain, the midbrain would be my thumb tucked inside there. So it's inner components, and it's very close to the brain stem. So imagine, if you would, my arm is the brain stem. And so the brain stem, anything that's really close to that brain stem is going to be very quick in responding. So we'll have a lot of our instinctive and survival responses there. Our life-sustaining functions are very close to that. And so the midbrain is just barely, kind of above and around, and involves those areas. The part of the logic and reasoning part, the decision-making, problem-solving part of our brain, is what we call the prefrontal cortex. And it's actually the outer layer right at the front. If you ever remember those old commercials, I could have had a V8, and people would go, oh, or when we're taking a test, we're leaning down and kind of rubbing on our forehead.
This is cool, yeah.
Without even realizing it, we're instinctively stimulating that thinking part of our brain. Well, when we take an addictive substance, the addictive substance suppresses the thinking part of the brain. We lose our ability to think clearly, to rationalize, to problem solve, and that's also the part of our brain that has to deal with our morals and values, what it is that we see and perceive as right and wrong. And so what happens when that part of our brain isn't working as well, the instinctive part of our brain, which is designed to help us to survive even when we can't think, kicks in. And it's so if you think about that exercise again, what happens, you're putting a cast on the thinking part of a brain. Now it's not working very well. You might be able to pick up a few pieces of paper or whatever if you have a cast on your arm, but it's not going to function fully. And then you're going to instead compensate. So the instinctive part of your brain isn't just working normally, it's functioning extra because it's doing its normal job, plus it's making up for that part of the brain that isn't working very well. So if you've ever had a broken leg or whatever, you'll notice that when you take the cast off, the one that's been in the cast is real skinny and kind of looking weak and sad, and the other one is like all buff, and that's kind of the reality, is that instinctive part of our brain becomes super, super efficient because it's been practicing and working out, and it's really very driven. So what does that instinctive brain do? Well, whenever the stress response is triggered, whenever we have stress of any kind, whether it's physical stress like pain or sickness, or whether it's emotional stress, or maybe we've just been working hard and not getting enough sleep or whatever, excuse me, the stress response in the brain gets triggered. And so one of the things that happens with the brain and that stress response kicks in is it has 3 options. And these are automatic options that are just ingrained in us naturally. And it's fight, flight, or freeze. And so those are generally the responses that our brain will automatically choose. When we introduce an addictive substance into it, so our brain remembers what things that we've done in our past that have worked efficiently, what's been the fastest and best solution to a problem. And the problem is that the instinctive brain only thinks about 15 seconds. So that stress response triggers that instinctive brain, and the instinctive brain goes, I just need to get myself out of immediate danger. The logic and reason brain helps you to find a solution, look for a problem, let's work through this, how's this going to affect me long term and short term. But remember, that part's not working so good. And so the only thing that the addict then ends up having to help them to resolve problems when they have a stress response that's triggered is fight, flight, or freeze. And so you'll see a lot of behaviors that go along with that. So what would fight look like? Well, arguments, denial, I'm not going to admit that problem, it's your fault, you made me do this, or it's not as bad as you think. And so you'll see some of that fighting responses. The flight, you'll see people running away. This is where you'll see some of that dishonesty and things in it. It's actually a way to get out of the immediate danger is if I can just get past this next few seconds with whatever I can say or do, then I can deal with the problems later on when my brain's working again. Well, the problem is that oftentimes that because of the nature of addiction and how the body starts to crave the substances, that there never is a point in time where that prefrontal cortex gets back online again to kind of work through it. And so what happens instead is it just reinforces that cycle of fight, flight, or freeze. So freeze might look like passed out from drinking too much. It might look like isolating in your bedroom and staying in the dark away from your friends. It might look like dissociating, just completely disconnecting, from reality, and things like that. And so there's a lot of different ways that manifests. But part of the reason why the addictive substances become so addictive is because the brain realizes that an addictive substance gives instant gratification, which is instant relief from the stressor. And so the brain goes, hey, I know what'll take that stress away real quick. And it wants to go back to getting that high or to suppressing those stressors and being able to not have to function at such life-threatening levels. And so the brain says, that's what I need in order to function. And so you've got the midbrain telling the body that it has to have that in order to survive the stress. The problem is that the prefrontal cortex doesn't get a chance to kick back in and be fully functional when those substances are on board or when the brain becomes damaged. And so they don't have the ability to make the choices to override that instinctive brain. And so a lot of the symptoms that we see, the dishonesty, the denial, unable to find joy in things that they used to find joy in because their priorities are different, because the priorities that were living up in their prefrontal cortex are now no longer on the table. It's now the priority of, I need to manage my stress, I need to feel good or feel better or not feel at all. And that becomes the new priority. And so then the brain just continues to build that habit, which makes reinforcing of addictive substances and behaviors so incredibly powerful and hard to break free from, because our prefrontal cortex is designed to help override the instinctive system. It's kind of like the boss, but if the boss is out of town, then their mice will play, and it's going to just keep doing that. If no boss comes in town, there's nothing to tell it what to do, and so it's just going to do the automatic what it's used to doing. So that's part of where the dishonesty comes from, the cravings to use. When the negative consequences hit, you'll see a lot of even with the negative consequences. I've seen people with, dozens of DUI charges and loss of family members and things, but yet they keep using, liver failure, and they're still drinking, and it doesn't make sense to somebody who can think, but for somebody who can't think clearly, it's survival. And managing stress, and that's the only thing that their brain tells them they can do to find relief. And so external support is going to be very, very critical in helping someone to recover, because we as support members, whether it's clinicians or family or peer support, act as that thinking part of the brain when the person can't access that for themselves. And so hopefully they will listen to us, and sometimes they don't, and that's unfortunate, but we are the ones that help them until they can retrain that brain and get it strong again, working correctly. And so that's basically what we do in treatment and recovery programs, is we help by giving a pseudo logic and reason brain through proxy. I get to be your thinking brain for a minute and process through it, and then we help to lower the stress to minimize the triggers so that instinctive brain isn't going crazy anymore. And that's recovery in a nutshell. But and I know it's really oversimplified. Sometimes addictions are different depending on the substance, and so the recovery is going to be different too. And sometimes the problem gets complicated by mental health or brain injuries or illness or trauma and abuse. And so all of those things really need to be worked on simultaneously in order to give the patient the very best outcomes. Now, I've heard people doing, well, I worked on this first and then I worked on that, like nicotine, for example. I'm not going to come off of everything. You're not taking my nicotine away because I have, I got to have something. Well, no, you don't. The reality is the sooner you get off of things and the sooner you address your problems and get a healthy support system, the better your health will be. Because anything that we continue to do addictively, whether it's a substance or a behavior, is going to continue to reinforce that addictive pattern of thinking and the way the brain is functioning. Interestingly, different substances impact different biology in the brain. So neurochemistry, if I were to tell you a neurotransmitter is a brain chemical. We have lots of different brain chemicals. Primarily the ones that we deal with in addiction, there are about 5 of them. Most addictive substances trigger the interaction of 1, 2, maybe 3 at most of those transmitters. But behavior addictions like pornography and eating disorders actually trigger all 5. And so now you've got 5 different chemicals being disrupted in the way they're functioning in the brain. And so that's definitely a different beast. And obviously with things like eating disorders, if it's heroin, you can go through the rest of your life and not have to use heroin again, but you can't go through the rest of your life without eating again. And so somehow you have to learn how to recover while still having that biological sequence of events occurring. And so it's quite a different type of dynamic, and it feeds on some of our very own instinctive, natural occurring tendencies. So we have to eat to survive. And so those eating disorders and sex addictions are very complex, and when you couple those in with some of the other mental health and behavioral health issues or physical issues, it becomes more and more necessary to have a holistic type of a recovery where you're not just focusing on just stopping the drugs and learning about the drugs, but you might also need to do some therapy, mental health therapy. You might need family therapy. You might need some physical occupational therapy. If you have a brain injury, you might need to learn how to make decisions again and to organize your thoughts again and things like that. And so there's so much stuff that can happen, and as the disease progresses, more damage occurs, and so it really can become quite complex. But I've seen people come back from some pretty amazing places where most people didn't have much hope left. And so I think that the healing process and the brain and body's ability to heal is miraculous. And with the right kind of treatment and support, a lot of really cool things can happen. A lot of miracles I've seen. Unfortunately, I've also seen the opposite, where people finally come in and go, okay, I'm ready. I really messed up. And then within a few months, their cirrhosis of the liver has taken their life. And it's heartbreaking. We don't have really the ability to determine at what point is too much and where's the point of no return of healing. What I do know is that a patient does not have to necessarily be completely motivated when they first get into treatment to be successful. The motivation actually comes as their brain starts to heal. And so just getting them in the door is the most important thing. And then keeping them there is the next. And then we deal with how to process all of that. And anyway, does that answer that question?
That does.
No,
that
really good.
leads me into what I was thinking. So I really relate to that because I was either argumentative with everybody, or I was hiding in my house, or I wasn't using my logic and reason brain for a long period of time. So once I made the decision to come into treatment, so that was the biggest hurdle for me as an addict, was just coming into treatment. And then without the drugs and alcohol or the behaviors that I'm doing, how long does it take to start getting some of that stuff back?
Well, if you can imagine a couple of different analogies. Well, let's use the one for road construction, for example. How long does it take to fix a road? Well, they're in the planning stages long before they're ever sticking a shovel to the road. The brain has a lot of processing to do in order to go through the healing process. Just like we have to put a plan in action, and we have to rent the equipment, we have to look at the budgets, and we have to get everything approved and all that. That's complex before we can actually dive in and do the work. We can actually start the healing process from pretty much once the withdrawal symptoms start occurring. The brain is already engaging the whole body in actually even before that. The minute that we start ingesting substances, the minute the substances are being either ingested or injected, or however we inhale them, the body has defense mechanisms, and it's already trying to protect itself and to fight them off and trying to get rid of those toxins as we put them in. The actual healing of the brain is also complex. One of the things that our body does first, it kind of has a list of priorities, kind of like we do as parents or employees or whatever. We have a list of priorities. What's the most important thing to do first? Well, the most important thing to do is safety, obviously. So keeping a person safe, if we're going to protect our children, for example, we're going to make sure that there's nothing around they can swallow. We're going to make sure they've got little mittens on their fingers so they don't scratch their face, and put them in a car seat and those kind of things. So our body's defense mechanisms are a priority. To learn how to defend yourself from those toxins, your body has to learn as it goes. It learns how to defend itself from different substances as the substances are ingested. And the more it defends itself and it learns how to process each different type of substance, it builds the defense mechanisms, which makes then, in order to get that same high, it's called tolerance. It builds a tolerance. The body can tolerate it more. And so that person has to use more to get that same high. And so that's the hard part, is the body is trying to heal and protect itself, but it can't, because the addict is using more and more substances, which fights above and beyond the body's ability to resist and protect itself. And so the damage keeps occurring because they keep using more and more, and the tolerance builds up, and so on. And so stopping the substance use is one of the most important things to do early on, because the more they use that substance, the more that tolerance level has to build up. And the body's using, let's say you have just only a set amount of energy during the day. The body has to use energy to protect itself as a priority. And so it takes the energy from other places in the body, like being able to process, when we get really stressed out, our body's systems go to the heart pounding, our ability to run away and fight and those kind of things, but our digestive system slows down. And so those kind of things. And so you'll notice that changes, physiological changes start occurring, because we have to zap the energy from some of the body's processes, our ability to focus and concentrate, our ability to process diet, and ability to sleep, because we're trying so hard to fight off the poisons, which are the priority. And so you'll end up with more and more problems, because those systems don't have the ability to operate correctly because they don't have enough energy. And so you'll find problems with fatigue and sleep and so on, and they just continue to build and increase. And so if you didn't have a problem with sleep in the beginning, the more you use an addictive substance, it's more likely that you're going to have problems with sleep eventually. And so sometimes we use an addictive substance to medicate our lack of sleep, and sometimes the addictive substance causes the problem with the lack of sleep.
Good point.
And so the reality is, when we finally introduce sobriety and they're not using that addictive substance anymore, the brain has the ability to actually relearn how to sleep again. It does take a few weeks, and so for that to occur, usually the first couple of weeks are spent with the body trying to get rid of the majority of the damaging toxins. And keep in mind, we store some of these things that if our body can't get rid of it fast enough, it'll store it in places where it won't cause as much damage. So rather than having it sit in our kidneys, for example, the kidneys will kind of back that up, and pretty soon it's backing up into the liver and the digestive system and so on. And so we'll start seeing more medical issues with that. And as our body systems start to break down even more, and then that's when we get chronic problems like liver disease and cirrhosis and fatty liver and so on. And so the body just can't keep up with the amount of damage and poisons that are occurring. So as we take the substance away, and the body's learning how to, working on getting rid of the toxins. One thing, and I always like to share this story because it was an aha moment for me in my training. We always referred to the beer belly. A beer belly is actually caused by, the alcohol breaks down in our bodies a lot like sugar. And so it's like excessive sugar, which turns into fat. Well, there's also some toxic chemicals in the alcohol or in the processing of alcohol that are harmful to the body. And so one of the things that the body does to protect itself, because it can't get rid of it fast enough, is to wrap it in fat and store it. And so that's why we get beer bellies and things like that. And so you'll notice people that use methamphetamines and so on, their teeth and their bones, their joints will start to break down, and their hair and their skin and things, because the body doesn't have, first of all, the energy to put into keeping it healthy, but also those toxic chemicals tend to go in and start decaying that area, because there's some of that chemical in that area, or that's affecting the ability for those normal things like the defense mechanisms of our saliva to break food down. And so we end up having a lot more problems with dental work and things like that. So essentially, the more problems that they have physically, that's going to make it a difference in their recovery process. But back to the question about how long does it take. I call week 3 to 5 the pink cloud period, because it's a part where they are no longer feeling the withdrawal symptoms. Their thinking process is starting to come back online. The reality of all the stuff that they've got to do and all the mess that they've made is right in front of them, and they're feeling strong enough, and they're eating again and moving around. And so they get overconfident in that period of time, and oftentimes it's one of the high risk times for relapse, as is the withdrawal period, because they're feeling so yucky. But that 3 to 5 week period is a struggle for people, because the reality that logic and reason brain is still very weak, like you just took the cast off. You can't go run a marathon with it yet, it's not strong enough yet. And so it's coming back online, and it's functioning, but it's very basic functioning. And so they take on way too much in that period of time. Oh, I got this. All I needed was to get sober, and I'm good. I can go back to work, and I can handle it. But they don't have the training of that prefrontal cortex to build it back up and strengthen it again. And they don't have the awareness of the skills and the insight that they need and the support that they need. And so it's a very high risk time. So that 3 to 5 week period, yes, it's great that they have that, ability to feel more clear and have energy and keep food down and all that stuff, but it's also scary because they're not quite ready yet. It actually takes the brain anywhere from 1.5 years to 5 years to completely heal. We call the period of time from the time those withdrawal symptoms like nausea and vomiting and all that kind of stuff, when that stops, the day that stops, all the way up until the brain is completely healed, is called post-acute withdrawal. So it's after the acute phase. And post-acute withdrawal is basically meaning the brain is healing. The brain and body works really hard on getting rid of the toxins and getting all the basic systems back online as the priority. And so sometimes rebuilding some of those pathways is not a high priority for the brain because it's focusing on preventing more problems. And so the brain pathways that have been destroyed or altered in addiction typically don't start mending and repairing and rebuilding until you've had about 6 or 7 months sober. And so it does take a long time. And there's a lot of stigma out there that says, you just have to stop using and you'll be fine. Well, no, that's not the case. I wish it was the case. If that was the case, we would, I'd be out of a job.
Yeah, and I was going to say they used to have like 30 days was like a standard thing before, and now it's, like you were just saying, the 3 to 5 weeks is in that window of you're just starting to think.
Yeah.
You're just starting to actually function right, not even really think, not fogged yet, and you're really ambitious then. I know when I stayed for that second time, I stayed for 38 days. I went back out because I was so confident. I got this.
Yeah.
So I think the extended time is definitely.
Yeah. And the hard part is because you're thinking again, you think you can do it without all the help and support, but you don't recognize, your brain isn't quite clear enough yet to be able to recognize that you still have patterns of thinking and behavior and triggers, and that your stress response brain is still going 90 miles an hour. It's super efficient. And so even if your logic and reason brain is kicked back in again, it's not operating anywhere near the, it's like, we talk about the yoke being equal. You think about a yoke of oxen or a yoke of horses. Can you imagine having a thoroughbred racing horse yoked with a donkey? How's that going to go?
Right.
You've got to recognize your brain is not balanced. It's not working like it should yet. And it's hard to explain that to somebody who doesn't have the ability to be super teachable. And so the influence of the family in that initial part of treatment is so essential. And I can't stress that enough, that being involved in family therapy, being involved in communicating, and not in pointing fingers and disciplining, because what that does is triggers the stress response, which then triggers the addiction brain. And so approaching from a place of love and compassion and respect helps to keep that stress response down and keep the patient able to listen and process things with that prefrontal cortex. And so a lot of good programs will have a lot of family involvement and things like that, and there's all kinds of other outreach sources, things like this website, for example, where you can get that support. So eventually the brain and body can heal, but it does take a long time. And now I had a knee replacement last year, and I'm finally able to ride a bicycle and go to the grocery store and do all the shopping instead of part of it, or having to sit in one of those goofy electric carts. But it takes time. I couldn't do that at first, and I don't know that I'll ever be 100% back to where I was before, but I'm functioning so much better than I was. And I think we have to recognize that as far as the brain functioning with the prefrontal cortex and the instinctive brain, you're not ever going to make your instinctive brain any less weak than it is. It's always going to be really efficient, and because you've trained it how to do that, it's not going to forget how to be efficient. What we hope to do is make the logic and reason brain just as efficient, and maybe even more efficient, so that it can override it, and that the two can work in tandem throughout the rest of your life. And sometimes when we're sick or when we got a lot going on in our lives. Our logic and reason brain is busy with other stuff, and our instinctive brain will kick in, and bam, all of a sudden there's a relapse. And it's not because we weren't thinking. It's just that we had so much to think about that the stress response of our brain had to kick in for a while, and relapse occurs, unfortunately. I wish it doesn't. I hope it doesn't. We try not to, but the reality is it does happen, and
that's what you do with that.
You have to keep falling down doesn't mean that you have to stay down, and you keep moving forward, and you can keep healing the brain and get it stronger and stronger. The more you exercise it, the more it works, just like your body.
Right.
Do you want me to? I'll look and see if there's some.
Yeah,
questions.
I was just gonna say real quick. So for the families, just talking about that initial withdrawal system, the actual withdrawal system. I mean, time. The families and friends that their thinking pattern has gotten rewired through that same kind of healing process, correct? Like Anna had a different thought process. She was almost in fight, flight, freeze as well, dealing with it. So she needs to heal a lot like I needed to heal her brain.
I'm glad you brought that up, and that I could talk on for another hour, but I'll try and keep it short. There's if you get a chance, Google on the computer or Bing jelly neck curve. The jelly neck curve is kind of like a cursive V or a U shape where it goes down and comes back up again. And if you look at that curve, at the top is normal functioning. When a person begins to use addictive substances, they don't all of a sudden jump to the bottom. They have kind of a downhill slope that they go down, and they start picking up and adopting more and more patterns of behavior and thinking that spiral them down to that place of, I got to do something, that catalyst for change. Some people call it a bottom, some people call it the point where I decided I couldn't do it anymore or whatever. But ultimately, as the addict picks up more and more behaviors like more anxiety, less sleep, stress is really high, they get depressed, they start losing their sense of self-worth, they disconnect from their spirituality, they disconnect from their loved ones, they start engaging in more and more self-destructive behaviors and isolating from people. It's interesting to watch that the families actually go through the same process at the same time. Only the addict's symptoms are caused from the addiction, whereas the family symptoms, we call it the family disease, is oftentimes driven by codependency, which is I have a need to help and rescue and fix this, and you have a need of being rescued and being helped, and so together we have this relationship that we function, but it's not healthy function. And so the family's obsession with needing to worry about the patient and what they're doing and are they using and how much money's in my account and all that obsession builds in the family member, just like the obsession for the substance builds in the addict. And both the family and the addict start to spiral down and becomes more and more overwhelming and more stressed and less ability to sleep and to interact with people and to find joy in things, just like the addict. And so
well, when you were saying that was the first time that maybe it's the first time I've heard that in a long time, you talking about honestly like the roller coaster again. And when you were saying all those different characteristics or things that happen in our lives, I was like checking off boxes in my head of what I did when I was so into that codependency. It really was. It was the isolation, stop eating, the overthinking of things that I need to save. It was just, it's so crazy how close and similar, even though it's on opposite sides, like that is the thing. It's the same coin. We really do go through a lot of the same things.
Well, and the beautiful part about that, obviously you have a lot of understanding and compassion because you're going through a lot of the same types of emotions and self-destruct, but you also on the return side, when the recovery starts, in tandem you start building a little bit more self-worth and confidence. You start being able to sleep a little bit better, you start being a little bit more honest and more connected and so on. And so it's I always say it's like when you play that country song backwards, you get your dog bag, get your dog bag, all that stuff. Because when you start going back through that healing process, you start picking all of those things up that you let go of, and you do it together. Interestingly, the addict is typically in front of the family member in that process, just a little bit. So the addict will be dishonest and making bad choices before the family is, but that does come eventually. Same thing happens in the recovery process unless the family member goes to get help before the addict does. But if you're doing it together at the same time, it's very common for the addict to be ready to set boundaries before the family is. And so that sometimes is like, what, you're setting a boundary with me, you're the one that screwed this up.
Yep.
And so you have to be patient. So I tell the people in recovery all the time, you need to be patient with your families, because they're not getting the intense amount of treatment and practice that you are.
Yep.
They're a little bit behind, and so you need to remember, and you can kind of be an example and a guide to them. And so it's kind of opposite of what you think it would be. Oh, we're going to guide you in how to be sober. Well, the reality is, if they're involved in a program, the program will be the guide. The addict will follow that, and the family follow along that, and just kind of along in those that recovery phase. But it's quite magical to see how and I if I can, looking at the situation that you guys had, once you decided, you were absolutely done and were no longer putting up with it, and you set that final boundary because you'd been tolerating it with the codependency for so long. But once you said no more, it's non-negotiable, I can't do this anymore, and if that means I have to face the consequences of it, then I will. Once you put your foot down, so did you in your addiction, and your life changed that day. And so I really think that the families have a lot more influence than they realize. They just don't know how to do it.
Yes.
And so that's where an effective support system and treatment program comes into play.
That actually leads into the next one, because in all honesty, I'm sure a lot of the questions are like this. Danny's actually one of our amazing followers, and she's from Brazil. She said, my husband has been to rehab twice this year and won't stop using. I don't know what to do anymore. Is there anything that Danny can do to help, or is it helping her?
I think a couple of things. First of all, safety. As I said, that's a priority. Keeping yourself safe is the most important thing. If you're not physically and emotionally safe in an environment, then you need to find a way to make yourself safe. Whether that means go to another environment or lock the doors or whatever you've got to do, you've got to keep yourself safe first. Because if you're not safe, then your stress response kicks in and you start reacting, fight, flight, or freeze, and not making rational decisions. And so keeping your own stress levels down is really important. The next thing I would say is to get some support. Whether you reach out to a therapist or a family member or a friend or whatever, to get some support to kind of help you through things. The next thing I would say is having a conversation, communicating, not at a time when the person's intoxicated or acting out, but maybe when they're a little more rational, so the day after or whatever, because nobody can argue with an addict and make any sense.
No.
And so you've got to wait until they're a little bit more clear-headed and willing to listen and able to listen. And so at that point, I would just say make your approach with respect, with honesty, in a calm manner, and approach them with some compassion. And it's hard, I know, especially if you've got a lot of anger or a lot of pain. You want to just shake them, but that's only going to trigger their stress response and make it so they can't engage that brain. So the most important thing to remember is, in everything that you do to interact with that addict in recovery, try and keep that prefrontal cortex engaged. Ask a lot of questions. Reflectively listen. So repeat back what you're hearing them say. So I hear that you're frustrated with the using of the drugs and that it's bothering you too. And repeat those things back, because what that does is it makes them think, exercising that brain. What happens when we exercise? We get stronger. So the more we can engage that prefrontal cortex, the better. I think that it's obviously going to take time, but when you can have a conversation without all the stress response, and you can be honest about your feelings and your boundaries, and I think that would be the next thing, is that you set boundaries, that you tell your loved one, I can't be around it. If you want to drink or do whatever, you that's your choice. But this is what I choose for me, and this is what's going to work for me and what's not going to work for me. And put the choice back on the individual so that you're not the one to blame, because that just creates more fire. But also, I think as a family member, if you say, I have to protect myself, if you want to self-destruct, that's you, but I want to protect me, and I think you want to protect me too. And so here's what I need to do in order to keep that safe. If you can't stop drinking, then this is what I have to do. And you set some boundaries. And sometimes those boundaries can be a simple thing, if it's substance use and not dependency. I don't want to be around you when you're intoxicated, drinking, or recovering from. Come see me when you're sober. And I don't want to talk about it, don't want to see it, don't want to smell it, and that might be a sufficient enough boundary if it's just somebody using substances. If they're dependent on substances, then it might be a different story. It might be, I'm not giving you any money, you can't live here, whatever it is, in order to protect you and keep your environment safe. And so boundaries are really important. If you're not sure what boundaries to set, or you don't know where to get help, I reach out to Mitchell and Anna. They'll help you find some places. There are so many places all around the world where you can get help and support. Whether you have money or not, or insurance or not, there's always somebody out there that can help you, and it's just a matter of knowing where to look.
Awesome. Can you take a few more questions?
Yeah.
Okay.
Yeah.
Because I know we had a few. Sorry, guys. I know you can see my hand in here. Let's see. Kathy wrote...
can I throw one last comment?
Go ahead.
Get your own therapist.
Yes.
It really, really does help. Even whether the patient is in treatment or not, you've got to be able to work through those problems and concerns and the amount of upset it's causing in your life. Don't be afraid to go and get a counselor or a therapist or a sponsor or something. Reach out and get the help that you need to keep yourself strong. Because if you're in a better place, you're going to be better equipped to help the loved one.
Thank you, Laura.
Yeah.
Thank you, Kathy, for the kind words. Truly appreciate it. Let's see. Luann wrote, why do addicts in active addiction push and stay away from the ones that care for them? How do they just forget them?
Well, I wish I could honestly say that they do forget them. They don't. What typically happens is they disassociate or disconnect because the shame and the guilt and the anxiety and the fear and the pain become so overwhelming that their brain has to kind of disconnect from it because it's only going to cause more further destruction, and the body has to protect itself from it. And if it can't stop the poison from being in the food, so to speak, it stops the hunger from happening. So what happens is they disconnect from their loved ones because it's a constant reminder of what I should be doing, what I've done bad, that I'm not enough, how much I feel sorry for the things I've done, or whatever. And so oftentimes when people disconnect from their loved ones, it's not because they don't want to be around. It's because they can't survive in the emotional and mental distress that it causes them when they aren't around. Most oftentimes I see the most tears when it comes to the shame and guilt that patients have regarding the impact and the negative stuff, the damage that they've caused in their relationships to their family, for not honoring the values and things that they were taught. And it's overwhelming. It's one of the things that I think holds them hostage.
I agree.
Oh, absolutely.
I agree. That's it with me. I mean, once we were able to separate the addict from real me, I was able to then empathize with Anna and look back at some of the things that I did in my addiction and not take it as healthy Mitchell did these things, because as soon as, even now at the year, if we start saying, Mitchell, you did this, Mitchell, you did this, the shame comes right back up, even with a year clean, but if we can separate that, I can logically say that's in my past, that's in the addict's past, that's the addict behavior.
Well, and I've had patients where I've told them, that have a really hard time letting go and forgiving themselves to visualize that the addict mentality is a separate part of themselves, and give it a name, like Hagatha or Brutus or something, and you can hear Brutus or Haggith talking in your brain, and when you hear it, just go, nope, I'm not going to listen to Brutus today. No commentary from Haggith that she's not in charge today.
Yeah.
And it's amazing to see how much more forward movement there is when they can separate who they really are from that addict mentality. And it makes sense, because the reality is that addict mentality is really created and driven by the instinctive survival mechanisms of the brain, and doesn't have anything to do with the personality, the person that's in there that loves and cares and wants to learn and enjoy life. It's all about fight, flight, or freeze. And that's what the addict mentality is. And so it's actually an okay thing. And some people might argue with that, but to be able to separate it, because the logic and reason brain is really where we develop who we are, what's important to us, where we want to go, our goals in life and things. And so it is a separate part of our brain that's operating.
And let's see, Christy, my husband has a traumatic brain injury, among other factors. Christy, like Laura said before, there's always hope, and strengthening that brain and doing that, there's definitely hope in recovery.
I highly recommend, if they don't have already, a physician that might specialize in traumatic brain injury, to see the level of damage that's there and what other areas and treatments are available to address specifically the traumatic brain injuries. Sometimes an occupational therapist helps, doing some of the basics like DBT skills and learning how to schedule and learning how to organize things really helps, because as they learn how to do those basic things again, those are some of the complications of many patients with TBI. They can use those skills now, that structural skills, to sort out responses instead of reacting. They can actually start to process and think things through. And so the more they can exercise the part of the brain that organizes and problem solves, the more they can heal. One of the difficulties with traumatic brain injury is that it does affect the emotions as well, to a great degree. People with traumatic brain injury end up oftentimes becoming very emotionally reactive, often with anger, frustration, anxiety. And so learning how to manage that and having a plan of safety when they feel angry, what's some options that you can put into place. So it's okay to be angry. What's not okay is this, or this, or how about instead of focusing on what not to do, let's give you an outlet for your anger. Go paint an ugly picture, or write in an angry journal, or take a walk, or something like that, where they have an outlet for that anger, so that it doesn't build, because that only complicates the reactive instinctive systems in the brain and makes it harder to recover. And so the more coping skills and healthy outlets that you can give to somebody who has a lot of emotional upset, the more likely they will be to engage that prefrontal cortex and be able to problem solve.
Awesome. And then let's see. Callie, I'm so sorry we can't see the rest of your question because I can't push the C more, but I saw that your husband, I believe, is 60 plus days clean and sober. That's awesome. Absolutely That's amazing. And if you us, reach out to us, and Laura did say I can ask her questions later. We are here to support our son Skylar Petrie and our daughter-in-law Emma. Someone else said fascinating, hanging on to every word. Callie, let's see. I'd like to know, how can a recovering addict overcome severe insomnia? Mine is struggling to develop good sleeping patterns.
Yeah. They call it sleep hygiene. And just like we have routines for our daily self-care, doing our hair and showering and eating, brushing our teeth and so on, there are some things that you can do that have to do with sleep hygiene that helps you to sleep better. Sometimes your brain just has to learn how to do it again. And so sometimes it's just doing the same routines consistently for a time. I've heard so many different ideas and ways of helping people to learn how to sleep more effectively. And not every skill and tool is going to work for every person. So you kind of have to figure out what works for that individual. I would say taking a pill for it, I would say, in my professional and personal experience, taking a pill should be one of the last resorts. However, if you're at that point where the stress is so bad that if you don't get some sleep, you're going to come unglued and then it's going to be a problem. I think that would probably be the exception to that. I think that there are so many things. One of the greatest things that I think are becoming even more and more popular in the recovery industry and in the hospitals and so on is meditation and yoga. Learning how to get your mind in touch with your body helps your body to calm down. And if I think about things like when our body shuts down some of those symptoms to engage in the stress response, we kind of have to do just the opposite. So let's say when we're afraid of something, a big bear's chasing us, the last thing we're going to be thinking about is eating something, or having a drink of water, or taking a casual walk. And so sometimes those are the very things that help our brain. So if I'm eating something, if I'm having a cold drink of water, a sugary soda, or something that's really cold, or putting a cold washcloth around your neck or hot washcloth on your face, and you engage some of your body's sensations in a normal exercise of some sort, sometimes what that'll do is signal to the brain, look, I'm fine enough to eat, you can calm down now. And the brain and the body will start to follow that. And so meditations and yoga actually help to retrain the brain to calm down and to let go of that stress response a little bit. I think watching TV or reading books in bed, sometimes people say the more I do that, the less I can sleep. And so when you go to your room at bedtime, have a routine and it's directed towards sleep, not just hanging out, not
until you fall
relax
asleep,
and
right?
and you train your body that when you're in your bedroom, in your bed, that means sleep time. And when you get up, if you can't sleep, don't keep trying longer than 20 minutes or so. If you can't sleep after 20 minutes, get up and go do something normal and calming so that your brain can see that everything's okay, and then try it again and do that sleep routine.
That's a good point.
And it's amazing to see how after usually only 2 or 3 weeks, I hear patients go, man, I slept better than I've slept in years. And it does kick back in, but your brain has to remember how, and it has to get out of that stress mode enough to be able to calm down. And there are some really good medications out there that are non-addictive, that do help people to fall asleep or to stay asleep. The problem with some of the sleep meds out there is that they can become addictive, and they also interfere with the brain's ability to function logically. So they've been what I call autopilot or zombie mode, where they're functioning but they're not really all there. And some of those sleep meds do that, and that does not help a recovering addict. If that's the type of medication, you'll want to look at other options for that. Stretching is good. Exercise is good. Doing some journal writing, empty your thoughts out onto a piece of paper before you go to bed, and leave it on the nightstand so that you don't have to stew about it all night, because the list will be there in the morning and you can look at it again and start your thinking again. You can put it away for a little while, take a vacation from your thoughts, those kind of things. I know this is going to sound goofy, but I love to read, and I can read lots of books, but when I read my scriptures, I zonk right out. So spiritually speaking, it helps calm me down, and zonk, I'm out cold. It's not uncommon to have people that have sleep disorders, so sleep apnea or things like that, especially if they've put on a lot of weight or had some other kind of issues. And so getting to a doctor to get things checked out is always a good idea.
Awesome.
Yeah.
And this says, would it be, from Chris, would it be helpful to send this to someone who is drinking as I write this?
Yes.
I think we can all say that absolutely yes, because you have to remember one of the big reasons why Mitchell and I created We Are Recovery is we wanted to show both sides of the same coin. That we all go through a struggle, we all feel isolated, we have this alone feeling within us. And a lot of the times what we need is that first ability just to not feel alone, and to reach out. And that's to even the families that, let's be honest, right? We're putting a mask on most of the times. we're putting a mask on, saying everything's okay, and we're isolating ourselves. And that's the same thing that's happening on the other side with the addict that's struggling. So I think the best thing is if we come together, like Laura said, with understanding and compassion. I think that will help out tremendously. So absolutely send it. And Mitchell is right here that you can always reach out to, and any of us. So
well, I think anytime you reach out to somebody who's actively using in efforts to try and help them, you need to communicate to them somehow in your own loving or silly way. That you're not trying to make them feel ashamed or tell them what to do, that you're really trying to help them, to give them information, to give them encouragement. And as you approach it that way, people are more likely to receive it than if it's just yet another thing to remind them of all the things they're not doing right. And so just be mindful of your approach and make sure it's a place from, hey, let's look for some solutions here. Here's an idea. Instead of, let's look at your problems for a minute. Because if we're problem focused, and I think that's where the addict likes to swim in the problems, the shame and the guilt, and typically it's not a very productive place for them, and it's hard for them to get to the place where solutions are found, because that has to do with the frontal cortex, the thinking brain. And so you be that thinking brain and give them that encouragement. Hey, there's some things on here that I think might be able to help you eventually, and when you're ready, maybe we can sit down and talk about it, or whatever. That's more likely going to help than saying you have to watch this or I'm not helping you.
Yeah, and I think just if you feel something, bringing it up whenever you're feeling it, because if you wait and just all this stuff builds up in your head, it's gonna it's gonna be harder to be kind if you're unloading on somebody. But if you just communicate often, I felt that's helped Anna and I tremendously. Communicating often and kind. And
Dawn said this is so interesting, isn't it, Dawn? Isn't she awesome? All right, and so Danny did ask, my husband's life is not stressful. Why does he keep doing drugs?
Because the body has become accustomed to that process in order to deal with. And see, life doesn't have to be like you've got the police chasing after you and a bear and you're financially upset. Stress comes in so many different forms. It can come from a low sense of self-worth. It can come from a lack of skills. It can come from a past history of trauma or feeling inadequate. It can come from the death of a loved one. It can come from stress at work. Our stress response gets triggered all day long, every single day. And typically, if it's not too powerful of a stress response, we can engage our prefrontal cortex and just work through it, push ourselves through it. If you don't have enough abilities and skills to process through it on your own, then your brain's going to automatically choose the default. There comes a point when, let's say if I told you to fold your arms, and this is the same way I've been folding my arms all my life. I tuck my right hand under and my left hand comes back up. And now I'm going to tell you do it the different way. Go ahead, try it.
That's weird. It feels uncomfortable.
That's not so easy. And so if that's the pattern that they've become accustomed to, it's going to be awkward and difficult and have to require constant attention and focus to be able to do it differently. And so that in and of itself can do it. But as the brain continues to be impacted by addictive substances, the brain alters in a way that reinforces that use over and over and over again. And so there may be some elements, and maybe the stress levels were low enough to not be the trigger point, but since the use has continued for so long, that in and of itself becomes the trigger point.
I just wanted to make sure, because I knew someone in the session. So this one says, my husband knows he needs help but does not want to go into program. I think it's because he feels ashamed and fear of judgment. So what advice could you give Charlene?
I would say see if he'd be willing to go take a tour or to sit down with somebody to talk about it. No commitments necessary. Let's just go talk about it and look at the options and the program and see what's out there. Maybe even go to a 12-step meeting together and hear what other people might have to say. Talk to other people in recovery and let them share their experiences. And even I would say, you go get the treatment yourself, and then come back and be excited and share what you've learned and the difference it's making in your life, and be an encouragement in that way. You can also set some boundaries, and you're going to have to make sure that whatever boundaries you set, you're willing to put the consequences in, because if they don't honor them, you're going to have to follow through. Otherwise, what you're teaching them is, my boundaries don't matter.
And it seems like a lot of people like that statement right there, because they're flowing up. So a lot of people understand that, right?
Yeah.
Oh, Tab, I'm glad you're on here. My husband has been in rehab more than 5 times. He still keeps coming out in relapses after 1 month. Fentanyl patches he chews. And of course, I can't read the rest.
Okay, one I can tell you is I'm trying really hard not to have a big head or anything, but I think in my years of experience, both personally and professionally, I've figured out a lot of things, and I really I like the challenges of people that are chronic relapsers, because they can change, even though they've been chronic relapsing, or they've had dozens of treatment centers and jail and so on. The reality is that there's sometimes things that they haven't dealt with, and so each time they go to another treatment center, they're learning something else, and sometimes the thing that they're learning is how to avoid the thing that causes them to drink or drug. And so getting to a place where you can find a treatment option that is very holistic, that does mental health, physical health, spiritual health, relationship health, and addiction all in one, is going to more likely be beneficial to that patient than one that just focuses, for example, on addiction only. And so I would highly recommend that. And the other thing is, each time somebody relapses, there's 2 things I always ask. Number one is, where did you lose your spirituality or your higher power? Because spirituality is that sense of self and what's important to you. Who are you and where you're headed? When you lose sight of that, and the other one is, when did you stop taking your medications for your mental health or whatever? Those are my 2 favorite questions to ask, because usually, even if they were in a good place and they were sober, and all of a sudden they're in the liquor store, guaranteed they're going to have a time when they let go of their spirituality and stop taking their meds or whatever within the last couple of weeks. And so if you can look at the early warning signs and catch them beforehand, then you never have to get to that point of relapse. And so recognizing, what is it that, where do you start down that path? Is it being dishonest? Is it maybe your finances aren't in order? Maybe it's you're not following your daily routines, you're not going to your meetings. If you can find where you start in the early phases before the negative consequences come, where you got off track, that's a big place to put a big flashing neon sign up there when you start letting go of managing your finances, or you stop doing your dailies. That's the warning sign, and you do something about it. Then you reach out for help at that point, instead of waiting until you're using the addictive substance. Do it beforehand, because once you start down that path, it's really hard to turn around the closer you get. And so stop it early when you still have your wits about you. And I think if you can learn to identify those early warning signs, you have much better ability to prevent a relapse, and to learn from it.
I agree.
Luann said, makes so much sense, addresses a lot of my questions. Thanks so much for this. You're very welcome. Kathy, this is an amazing explanation. Thank you so much. It's helpful to the biology of addiction. Hi, Christina. My husband says, Tab also wrote, and my husband says I don't know how to support the person because I tell him the truth about himself.
Unfortunately, you got to remember that you're trying to talk sense to somebody who doesn't have the sense part of their brain working. And so, one thing I do, if I have a patient that's intoxicated, I do the safety thing first and kind of assess their situation, but then I don't go into any of the therapeutic deeper stuff until their head is clear. Because I know I'm not going to get either a straight answer, or they're not going to remember it, or they're going to manipulate it somehow. And so trying to talk to somebody in that mental state in a deep way is not going to work. And so, if you want to fight it out when they come home drunk, good luck with that.
Yeah.
It's not.
I learned the hard way.
Wait until the next day when they're a little more sober and maybe even a little headachy, and then have the conversation, because they're more likely to go, yeah, I feel pretty crappy, and it looks like so do you.
Right.
And
Right.
you'll be able to work through that.
And to be honest, that was the same with Mitchell. If it was, drunk Mitchell, high Mitchell, there was no emotions. It was straight just
and
staring at
if you
me.
engaged, I wouldn't remember the next day.
Yeah.
I probably fought you.
Yeah, and that's probably the time when the addict is going to say the most damaging things too, that are going to hurt and stick with you. And so it's best just to
Go to your
that
safe
push.
place and let it go. Yeah.
Hi, Tracy. Hi, Richard. Oh, Sarah-san. Hi, Sarah.
Oh, nice.
Let's see.
Can I throw a subject out really
Absolutely.
quick while you're looking? I was just thinking about forgiveness. Forgiveness is such an incredible component in the recovery process. Forgiveness doesn't mean that what happened was okay. It never means that. What it means is that I'm choosing to take responsibility for what's mine. I'm allowing you to take responsibility for what's yours. And I'm learning from this, and I'm moving on with my life. I'm not going to let it hold me hostage anymore. I'm not going to let it impact me anymore. And so when you think about somebody who's hurt you by stealing belongings or money or using your credit card or whatever, or hey, they've said some hurtful things, I want you to understand that when you forgive somebody, it doesn't mean what happened was okay, because those things are not okay. They'll never be okay. But able to forgive and really be able to move on and create a healthy relationship, you can't bring that baggage with you, because it will just keep resurfacing. And so there's got to come a point when you recognize, okay, I'm ready to let that baggage go. Sometimes you carry it with you because it's not resolved yet. So resolve it and then get rid of it. Don't keep it for later, because it'll just surface again. And so truly learning how to let go of it means, this is done, it's over, that's in the past, I'm not going to look at it anymore. I like to use the analogy of a vehicle. When you're driving in the car, you got this great big huge windshield, and you got these great big side windows. You can see where you're at and where you're headed really well, but there's a little tiny rear view mirror.
Yeah.
And I only need to learn from my past. I don't need to carry it with me. Where have I been? And what's the purpose of my past? And so it's okay to remember a little bit of it, just enough to help you learn and grow. But where your focus needs to be is on right now and moving forward. Solution focused. I can't control tomorrow. Let's say the analogy was depression is worry about the past, and anxiety is worry about the future. Today is a gift, and that's why they call it the present. It's where our power is. I can change today. I can do something today. I can't do anything yesterday, and I can't do anything tomorrow. I can just do today. And so allow yourself to look at what's the goal just for today. Just for today, to stay sober. Okay, so what do we need to do to stay sober just for today? And you can figure out a plan that's really simple and not complicated, and then do it again tomorrow and the next day. And just take it one day at a time. The healing process is so overwhelming, and it's so complex, and it takes time, and I don't know anybody that can heal from the disease of addiction without a whole bunch of support. And so it's not a he's in recovery, it's a we're in recovery.
Yes.
As a family, as a community, this disease kills more people than anything else on the planet. And from a spiritual aspect, and I'll tell you from my own personal views, there isn't anything that represents Satan and his minions more than the disease of addiction. It'll literally tear you to shreds, and everything that you hold dear, and prevent you from enjoying life in any way, shape, or form. And I look at people who are in the midst of addiction as some of the ones that the adversary's going after. And there's a reason why he's going after them, because, and many of you that have a loved one who's an addict, and you know who they really are inside, know that they're some of the most intelligent, most loving, most compassionate, most creative people on the planet. Well, that's the reason why they're being targeted by the adversary. And so for me, I want to help them to build confidence in who they are and who God created them to be. And as I help them to do that, I find that they have a lot more ability to let go and forgive themselves. But to forgive themselves when they feel like they're just broken, damaged, junky, or drunk, how do you move on if that's what you believe you are? Sometimes helping them to remember how priceless they are and who they are to you, really makes a difference, and they can start to glean to that. Some people are very resistant to it though, and so you have to kind of give it to them. How do you eat an elephant one bite at a time? Wow, you did such a great job with that. Thank you so much for learning, and I'm so glad you're here. Or I'm so proud of you for talking about this difficult thing. Those things mean so much, and they open the door just a little bit at a time to the healing process.
All right, guys, we're going to take just a few more questions because
Forgiveness is just definitely...
Yeah, just looking... Because I want to make sure that Laura gets her thing, and there's actually a lot of questions. So I will tell you guys right now is we will either have Laura on again and we'll figure something out of how we can do this. Or, like I said, I will send Laura the questions. But we're just going to take a few more, guys. And no matter what, too, Mitchell and I also will try to answer your questions as well.
We try to channel Laura as much as possible.
Yeah, we do.
Well, I've had some good teachers in my experience, too.
Are there any medications that help with cravings?
Yes, there are several. I am not a big fan of a lot of the medical assisted treatments out there, namely the synthetic opiates, because in my experience, it's just prolonging the problem. So many people have the ability to recover and don't think they do. And I think if you just get into a right kind of a program, you can get through it without having to go that route. However, there are people that really just can't, and that's the way to be able to sustain employment and relationships. And so I understand. I've seen some that can do that and be okay, and I've seen others who have been absolutely devastated by that. Yeah. My favorites are there are multiple different types, and there are new ones being made all the time, but there are many that are now what they call blockers, which actually block the receptors in the brain, so that if somebody uses they don't get the high that they normally would if they were to get intoxicated. And there are some that help to minimize the cravings. So there are several for alcohol, there's some for opiates, and like I said, there are new ones being made all the time. Good to talk to your doctor or an addictionologist or a treatment center about it.
And Vivitrol, I did see actually someone responded to, thank you guys for having that.
Vivitrol and naltrexone are some of my favorites. Especially the Vivitrol in the shot form, because they get an injection in the behind and it stays there for 30 days and they can't stop taking the pills because it's in their behind.
And honestly, I think that most insurances are covering that stuff now because it's preventative maintenance.
Yes.
So I did Vivitrol for 6 months, and I mean, I had a year 2 days ago.
Yep, right. Exactly. Oh, Jen's on. Hi, Jen. We love you. Let's see. You mentioned genetics. Is it more about the individual being exposed to the person within the family or other factors?
Well, there are several different risk factors involved. The genetics, being genetically predisposed, obviously because our bodies learn to adapt to the things that we experience in our lives, including the diet that we eat, the substances that we ingest, and so on, as well as our stress and patterns of behavior and thinking. And so we pass that down. Some of them are passed down behaviorally, and some of them are passed down genetically. So as far as the genetic goes, there's been quite a bit of research done on this in the last couple of decades. And they're learning so much more about the brain, and they're learning it at such incredible rates of speed with all the technology that we have that they're trying to catch up with publishing all the things that they're learning. But they've been able to isolate a couple of the proteins on the genetic strand that indicate a predisposition to it. And so there are some elements to the actual DNA that shows the genetic predisposition, and like I said, there's some cultural and ethnic types of things. So when, for example, we know Native American Indian populations are more susceptible to alcoholism, and that makes sense if you look at the history. For a time there, when they were put on reservations and pushed out of their homelands and so on, they were starving to death. And it was easier for them to get alcohol and whiskey and stuff. And so their body became very acclimated to that. And I think in the generations since that time, the bodies have adjusted and acclimated to it. Of course, there may have been a predisposition from thousands of years before that. I don't know. What I do know is that there are some genetics involved, and that we can alter our genetics through our own life experiences and things. So if we're somebody who is a very high stress functioning person, we pass that high stress functioning down to our children and so on. And behaviors add to that.
Which also means we can change
Yes.
our destinies too.
Yes.
So
Yes.
alcoholism is and abuse is in my family, but me getting healthy, Anna working on herself and getting healthy, we can change our
Future
future
generations.
generation. So
Yeah.
And Laura, this must be somebody. No, it's Brandon Nora Evans. We love you, Laura. Thank you so much for all your help.
Love you.
Let's see. Oh, Melissa, I am the loved one of an addict, and I'm learning. I just started watching you guys, and I hear these things you have went through. Melissa, thank you very much. Yes. Keep on, and if you need to reach out to any of us, we are here for you, okay? Always know that. Richard Pimpler said, thanks so much for doing this. Joshua, thank you, Anna and Mitchell. Callie is my wife. I'm 60 plus days clean and get REM sleep, and Seroquel doesn't keep me asleep. That was the one that you asked before. Just know, Joshua, if you need to reach out to either of us, we have Laura's phone number and everything like that. So always reach out to us. We can help the best that we can. We did answer that question. Thank you so much. Your mommy's on.
Hey, Mom.
And then Tab did say, so I shouldn't get angry right away because that's my issue.
Well, being angry is okay. It's what you do with the anger that can be a problem. Quite honestly, I'm very angry myself at how much addiction destroys people's lives, and I see it all the time, and it makes me angry. But what I'm going to do with that anger is use it to help motivate me for change, instead of allowing it to hold me hostage.
And then Mitch is on. Hi, Mitch.
Hey, Mitch.
Let's see. Everyone's I love how you guys are talking. Just with each other too. That's absolutely amazing. Bob just got out of rehab second time. Huge guilt and fear feelings, especially for my poor wife who keeps sticking with me.
Can I respond to that?
Yeah.
Bob, I'm so proud of you, and I'm glad for your honesty and admitting that you're where you're at and that you're still struggling. That's an indication of a good recovery, and so keep up the good work. It's going to be hard. That's the reality of it. I wish it was going to be easy, but it won't be. But just because it's hard doesn't mean you can't do it. You can do hard things, and you made it this far, you keep going. And if you fall down, you get back up and you keep moving again and again and again.
And I'm going to say right now, just truthfully on here, because we actually did, I think, answer all the questions. And if we did not, guys, and there's something we missed, please voice it, and we will get back to you through typing it to you for absolutely. But I just want to say personally on here to Laura, seeing we're having her here, is honestly, Laura, this is the truth, is Mitchell and I could not have made this. We could not have made it this far without you. I know that people say, give yourself credit, give yourself credit. We are giving ourselves credit. We do know that we put in the work, but I will tell you, it's one of those things that when you feel like you're in a room and you're locked in there, sometimes you even lose sight that the door is actually there. But you came up and knocked on both of our doors.
And I didn't just knock, I banged
Yeah,
on
you
it,
banged
so
it.
I set up camp.
It pushed it straight down. But I will tell you, for all the calls that I made to you, and I want everyone out here to really understand this and know, is that if you are struggling, reach out to anybody. Reach out. There is support out there for you. I can't tell you how many times I didn't realize that I was isolating myself. And when Laura came into my life, and truthfully, it was when Mitchell made the choice to come into rehab. When we came in here, I called her constantly all the time, but that is what I needed. She gave me that nice love and then that tough love, but that tough love is still nice love. And I just want to say, Laura, honestly, I love you so dang much. There's a reason why we gave you that angel with the candle, is because truthfully, for a while it felt like our candle wasn't lit. And you came up to us and lit our candle, and like you just said to Mitchell the other day, you want to help everyone out there, but it's so hard because there's so many people. But passing on your knowledge so that we can pass it on to others is what you did do for us. And that's what we do with this page, is you gave us the knowledge, the know-how, and to know it's okay to express ourselves in vulnerability. And that's why we're on this page now, and it's helping people all around the world. It really is. And I greatly, greatly appreciate it. And I honestly, out there, I want you to just finish it off and honestly say to people out there right now that are struggling, that are the addicts struggling, that are in recovery, and to the families and friends, if you could tell them something, what could you tell all of them?
Well, first of all, I would like to say something that you've probably heard already before. What an honor and a privilege it is for me to be able to work with you, to teach others. I don't know other than to tell you that it's just something that's a part of me, that it's like a fire of my own. And, I think I was part of the reason I went through the crappy stuff I went through in my childhood was to prepare me to do what I do today. And so if you can take that little bit of information and recognize that just because things have been bad doesn't mean that they're going to be. And I look back at what I went through as an adult child of alcoholic addict parents, and having been a survivor of abuse, and grown up in a house with 6 kids that were born within 7 years and moving all over the place. And, every single difficulty that I went through taught me something. And as I've learned how to pay attention to what I've learned, I think one of the biggest lessons that I'm learning is that I'm learning that I'm a survivor. And I'm learning that all of the things I've been through have given me experience and knowledge and confidence. And how do you get confidence? Well, you get out there and you practice, and you do, and you fall down and you get back up again and you keep doing it. That's how you build confidence. And so I think the message that I have for all of you, first of all, know that there are people out there who just genuinely want to just love you. And you need to let them. Don't swallow your pride. Your ego is not your amigo, as they say. And let people help you, because this is not something that any one person can do alone. And let people love you, because you need the love, and so does your addicted loved one. And the other thing is, if you fall down, don't stay down. Get back up and keep fighting. You are strong enough. If you can fight this most deadly disease, by golly, you can fight anything, and you can do it. And find a way. Find the support. Don't take no for an answer. Keep trying. Keep fighting. And just know that I'm doing a funny dance and cheering you on in the background.
Yeah.
That's right.
And that's a true statement.
Yeah.
Do you want to say anything, Mitchell?
I love when you were talking about just the forgiveness, because you taught me how to forgive myself, because every time I came back in here, you always reminded me that I was a child of God, and that He would always forgive me. And I finally got that. And just through your love and showing everybody here love, that's what we need the most of, is just care, love, and compassion. And by seeing it, we feel it and we see it in ourselves. And without you, I never would have gotten that piece of it. And now I can share that with other people. So just...
Well,
you're
I
a
love
blessing.
to love you.
You're a blessing. You're a blessing to us, and I'm so happy that you're in our lives.
Thank you.
And thanks for coming on. And
Thanks for
you're just
having me.
spreading
What a fun
word
time.
to
And I also have a passion for it. I think God put me here for a reason, to do these things and to keep doing it, and I'm going to keep doing it till He tells me otherwise. So I'm not going anywhere. If you have questions, ask away, and I may have to spread out the questions to other people, because I can't answer them all, but I'll sure try.
Yeah. Awesome.
I'll do the best I can.
Well,
I love you, and I'll pray for you all.
Yeah, thank you guys
We love
so
you
much.
all.
We love you all, and we'll be on again in about a week or so. But thank you so much, guys, for being here, and thanks for being amazing.
Okay.
All right, guys, love you.
Bye, everybody.
Bye.